Could a powerful party drug, you like that, huh? Actually help people suffering from psychiatric disorders? A new study suggests this could be just the case. Take a look.
The World Health Organization estimates that more than 300 million people suffer from depression. While there are medications to help, there is no one cure-all. But researchers in the United States recently discovered that ketamine, a popular but illegal club drug, might be effective in treating some psychiatric disorders, such as depression. A nasal spray containing a compound of the drug reportedly significantly decreased suicidal thoughts and reduced depressive symptoms in just 4 hours. Although the effects wear off at day 25, it may be suited to those at imminent suicide risk. Could this really be an effective new treatment or a dangerously addictive detour?
So is there a place for ketamine in the treatment of depression?
You would be amazed, but there absolutely is. And make no mistake, this is the same ketamine that people are abusing. This is the same ketamine that I'm sure you've seen.
We use it in the surgery center.
Absolutely. It's the exact same drug, lower doses. And so right now, what we know is that ketamine blocks the glutamate in your brain. And with lower levels of glutamate, then you have a less chance of being depressed. And it's working within 3 hours.
So I understand this particular drug has a very specific role in terms of people who are very, very depressed and considering suicide in terms of interrupting that suicidal thought and process, correct?
It does, but with a lot of things in psych, we don't know exactly how it works. We just know it works beautifully. We have people who've been chronically depressed 10, 20 years. They come in and 3 hours later, they're like, oh my God, I didn't know it was possible to feel like this.
Well, I mean, it's so important to have a drug like this because we know if somebody's suicidal, SSRIs aren't going to help them. It takes weeks for that to kick in.
And if you're having side effects, it can make the suicidal thoughts worse. It's very promising. The nasal form of it, if that works, we're going to have to regulate that a lot because I'm depressed. You're giving me something that's going to make me feel better in 3 hours. I want to hit that every hour on the hour. So there's a chance of that becoming very, very addictive.
But it's a great tool, but you want to make sure you're doing this with the proper therapy and other medications as needed, right? Because you want to get to the root of the problem.
Dr. Nita, 10 to 20% of the cases with depression, we don't know why you're depressed. It's a chemical imbalance. Everything else, there's usually a reason why. And so the cure is in the therapy. And what I say is the medication is there to help you from hitting rock bottom while we help you work through the thing that's got you depressed.
So this may have a role in those acute situations where someone is pretty close to rock bottom. You just want to go in and interrupt that, but then you're going to do the work.
And it's absolutely, and it's a great tool for you've been there, you've tried everything, you're hopeless. And that's the hallmark sign of depression. This immediately gives you hope.
And best to be done in a hospital setting or at least a monitored setting where you're monitoring vitals and things like that.
So Dr. O, right now, there are special docs who are trained to prescribe ketamine in office. You go in, you get an IV injection, they sit and watch you for the side effects. You can have increased heart rate, increased blood pressure, and you can lose a little touch with reality. So we need to watch for that. So you're prepared for that. But when you go
I've seen that in the operating room with bigger doses.
Yes. Coming out of anesthesia, yes.
Oh, yeah. All right, well, very interesting. If you or someone you know is suffering from depression, call the National Suicide Prevention Lifeline at 1-800-273-8255.